First thing I want to say before we go into any discussion is I want to thank everybody for participating, for coming out, talking. We received a number of outreach through emails or phone calls. I've had at least what I remember to count 32 encounters from individuals personally outside what's come into the office and what's come into the room today. So it's definitely an item of interest to the community, and I really want to thank you all for coming out and participating in the discussion today. So with that, who would like to open up the discussion? Commissioner Teseo.
Thank you, Mr. Chair.
I got one more.
Well, what's before us today is an approval of an emergency ordinance requiring face coverings. I'd like to point out that to have an ordinance and a mandate, and what a mandate does, it compels someone or orders somebody to do something or face penalties or some type of enforcement. In general terms, that's what a mandate does, and that's what this ordinance is laying out. You want your ordinance to be effective, it has to be able to do what it says it's going to do. And as I went through this was posted, I think, on Friday. It was posted, and it was done by emergency adoption, and we exercised waiver of notice. And on that account, it reduces the transparency, due diligence, and due process that really the community, me as a commissioner, really should have had to completely digest this and to get it into the public domain. So it really fails on that account right out of the box. But let's go through what this actually says. It references on the very first page that the CDC recommends wearing face coverings in public settings where other social distancing measures are difficult to maintain. And then we just had a health advisory put out last week by our State Surgeon General, Dr. Rivkees. It says all individuals in Florida should wear a face covering in any setting where social distancing is not possible. And to my point earlier, if you were here, I asked our health official about two people wearing masks that are close proximity to each other as opposed to social distancing. Social distancing is the higher, more effective standard, and that's laid out on the first page here. Yet what does this document do? It actually made social distancing the more effective treatment against COVID an exception rather than the rule. That doesn't make any sense, but that's what it says. It was touched upon earlier about enforcement. So let's go through the enforcement part, which is obviously part of an effective mandate, is the enforcement. How do you enforce 11 different exceptions? Well, you really can't. You can't enforce it. You can just take a look at just two of them. You're exempt if you observe social distancing. How are you going to be able to objectively enforce that? You simply can't. And the third one about health conditions, that was already spoken about earlier. There's Hippo Laws in effect. You can't ask people for papers. You can't do that. All anybody has to do is say they have a pre-existing health condition. So the social distancing and the pre-existing health conditions are two get-out-of-jail-free cards that anybody can claim. So essentially, if you read the language in this document, it essentially neuters itself and renders it useless as a mandate. So if we're going to vote on something that's useless, it's not going to get my vote because it's not doing what it's intended to do. It's really a recommendation disguised as a mandate. This is what people support, I guess, to make people feel good like they did something but really did nothing at the end of the day. I did look at different mandates from different states, different parts of the county, different parts of the state of Florida, and different parts of the country. And a lot of them are different in many respects. There's very little consistency in anything between these proposed mandates, although we did borrow this and tweak it a little bit to fit Charlotte County. We borrowed this from the city. So doesn't mean we can't do anything as a board. We have more tools in the toolbox than just ordinances. If we go to our rules of procedure, the Board of County Commissioners, we have the ability to have resolutions, not just ordinances. And in a resolution, we don't have to mandate anything. We can simply point out some of the items contained in the most recent health advisory from Dr. Rifke's. We can simply adopt the section where it says wearing face coverings. And we can put language in there that essentially the board requests that all businesses adopt or implement or administer the resolution. So they can do it by choice if they think it's in the best interest of themselves, their customers, their employees, and the community, instead of mandating it. So we can actually put some of the same language that's contained in this proposed ordinance, and we can implement it in the form of a resolution and essentially serve the same purpose of educating the public on best practices. We've done that from day one. I remember when we opened the beaches probably a little over 2 months ago, we got emails saying we had blood on our hands and we were killing people. There's been no spread from the beaches in all this time. I went out to the beaches and inspected for the first week. Everybody was respectful of what we were doing in terms of social distancing and trying to do the right thing. I asked the health official earlier, is the spread coming out of facility spread from our retail centers? He said no. I've yet to hear that our big box retailers and grocery stores have been causing spread in Charlotte County, yet we're mandating masks for all those facilities. I've been in those facilities. They have done best practices, many of them. Are there probably some that are sloppy? Yeah, absolutely. You're going to have some outliers. But for the most part, they put up stickers, 6 feet of separation. They have their employees do stepped-up sanitation. Some of them have masks as a company policy. Right now, businesses can mandate masks themselves without needing government to step in. But in talking to some of the businesses, they would like the backing of government. So how can we do that? We can have a resolution asking them to adopt the resolution and make it part of their business plan so they've got the backing of government. Because we are here to look out for the health, safety, and welfare of the community. It's how do we get there? And if I'm going to have to vote on a document like this doesn't get us there. This gets us nowhere. It's not enforceable, as was talked about early. It references Code Enforcement Code 1-1-1-15, and there is a pathway, I think, to an earlier comment on if somebody wants to contest. If you look back at that code, it does have a way to contest. But to enforce this the way it's written in the ordinance, 2 people enforce it, code enforcement or deputy, sheriff's deputy. If a sheriff's deputy writes you a citation, you have to go to county court. If a code enforcement officer writes you a citation, you've got to come to a special magistrate here in this chamber. That's not consistent. And if you read the enforcement part of the ordinance, it talks about code enforcement and law enforcement officers shall use their discretion. Talk about subjective. Everybody's discretion could be different. How do you uniformly enforce a mandate with subjective standards? You can't. Gentlemen, if we want a mandate in this county for face coverings, it better be a mandate. Either it's on or it's off, or you got a fine. That's it. That's the only way to do a true mandate. Everything else is just window dressing. So I'm just come to the conclusion, you can't lead a horse to water and make it drink. What you have to do is get the horse to realize it's in its best interest to drink. I think what we've been doing from day one as part of a board, talking about the guidelines, best practices, getting the word out to the community. We've done it verbally through recommendations, but I think a resolution may be the next step, because now we put it in writing, and now businesses can adopt it and say, we have the full faith and backing of the board through a resolution to adopt the standards set forth in the Department of Health advisory that if you cannot maintain social distancing, you need to wear a face mask. And that'll give the businesses that written backup that I think they're looking for. So I think there's an alternative to a mandate. Again, this is so poorly written. it would be unconscionable for me to approve this thing.
Mask. However, we have a problem. We have a problem in the community that I think requires and I think our Dr. Pappy mentioned it earlier, the need for community support, the need to get our businesses to partner with us to try to solve the problem. We're not going to do it with fining people, not with exceptions to in an ordinance that, good grief, your managers of your store, they're going to ask, is that a 2-year-old or a 3-year-old? You know, I mean, it's not good. The ordinance as written is not good. However, we need a plan of some sort, and I was trying to figure out what kind of a pathway, because you said it correctly, the businesses have the right now. No shoes, no shirt, no mask, no service. They can, but that's their choice. I want to give it as their choice. And I guess if some of the businesses are hesitating, taking that next step, and would be more comfortable with doing it, and I'd like to reach out to the business community and confirm that. Basically, I think that if that provides them the support they're looking for from government to get a resolution from this board that simply reinforces what the Florida Surgeon General has already indicated, that sounds like probably a reasonable approach. I'd need to see more about it. I have to reach out to the business community, and I haven't done that yet. But I am not in favor of mandating. I mean, you're right. And that's why I initially asked those questions this morning. Can we enforce this? We can't. We don't have enough resource with the county and the code enforcement department. The sheriff doesn't have enough resource to enforce it. It's going to provide a false sense of security to some people that think, oh boy, they've got a mandate now. So and folks will get cited if they don't wear a mask. That's not going to be the case. I heard over the weekend the city of Punta Gorda, a week ago, passed their mandate, and I heard there was a restaurant in downtown that was wall-to-wall people, no mask. You know, it's people. I was in North Carolina where the governor issued a mandate in the end of June. I walked down Main Street of that particular town. I didn't know what the situation was, so I had a mask on. I was the only one on Main Street wearing a mask. It doesn't work because they can't enforce it. There's not enough cops in that town. So anyways, I'm in support of not doing this ordinance, Mr. Chairman. Thank you.
Thank you, sir. Commissioner Constance.
Okay, where to begin? Thank you, Mr. Chairman. I've received quite a bit of correspondence, and this is from individuals in the healthcare sector, people that are on the front lines. I have a letter from Dr. Berger. Gentlemen, as a practicing urologist in Charlotte County, we're now getting word from local hospitals that COVID-19 situation is worsening. As we all know, mask wearing is important in control of this virus. We are required to wear seatbelts and to have car insurance, so it seems a little silly that it is unconstitutional to require masks in order to protect public health and save lives. Since we do not have a mask mandate from the governor, the Charlotte County Commission should have the courage to make a safety decision based on scientific data and not on politics. And of another email from Dr. Bott, who is a pulmonologist. Dear Commissioners, I'd like to introduce myself. I'm Dr. Salagrama Bott, a senior pulmonologist in town. I have been a resident in Charlotte County for 37 years. I love the people of Charlotte County. As you are all aware, we are seeing a surge of clinical coronavirus cases in the local hospitals in recent weeks. To minimize further spread of cases, I kindly request that you all vote for wearing masks as a mandatory requirement. The president of the medical staff at Fawcett Memorial Hospital, Eric Coronado, wrote, Commissioners, the medical staff leadership at Fawcett Hospital respectfully requests that the county commissioners consider supporting a vote in favor of mandatory masking ordinance in Charlotte County. As medical professionals, we believe this is important to slow the spread of COVID, especially given the vulnerability of a high percentage of our community residents. Monroe County recently issued an ordinance that seems reasonable in terms of its requirements to wear a mask in public for all locations that have a roof. Please find the details of the ordinance, and he gives the address. Please let me know if you have any questions. From Girish Patel, the President of the Chief of Staff at Bayfront Health, Port Charlotte. Gentlemen, at the General Medical Staff meeting on June 25, 2020, the entire medical staff at Bayfront Health, Port Charlotte voted unanimously to strongly support the approval of a mandatory mask ordinance within Charlotte County. Coronavirus-19 is a pandemic that is running rampant throughout our county. It has been proven that one way to help the slowing of spread is to use a face mask. As the healthcare providers of this community, we strongly urge you to mandate the wearing of face masks in public areas to help stop the rapid spread of coronavirus throughout the community. This is a horrible disease that needs to be controlled as much as possible. With Charlotte County residents being some of the oldest people in the United States, our residents are even more vulnerable to this disease, and we feel it requires stronger measures to ensure their safety. Please help us and safeguard our community so that we can perform our duty to ensure the health and safety of our residents by approving a mandatory mask ordinance within Charlotte County. From Bayfront Health, Punta Gorda, from Dr. John Coons, the Vice Chief of Staff. Dear Sirs, as the leadership of the medical staff at Bayfront Health, Punta Gorda, the Medical Executive Committee voted unanimously to strongly support and urge the passing of a mandatory mask ordinance within Charlotte County on June 23, 2020. Being the healthcare providers of this community, we see the dire importance of mask wearing being one of the most important measures to help stop the spread of the coronavirus-19 throughout the community. We see on a daily basis that this virus brings to our aging community and cannot urge strongly enough the importance of slowing the spread. We strongly feel the mask wearing is a tool that helps with this goal. With the residents being some of the oldest in the United States, this makes our residents even more vulnerable to this disease and requires stronger measures to ensure their safety. Please take our recommendation to enforce a mask ordinance within Charlotte County to heart. We only have the safety and health of our residents in mind. Dr. Coons. From Dr. Bobe, who is a pulmonologist, one of the 5 that are still practicing intensivists in town. She sent that this morning at 12:16 a.m. Dear Charlotte County Commissioners, I have been a resident and a working pulmonary and critical care physician for Charlotte County for the past 10 years. I'm a woman that has dedicated my life to my family and my career. I'm writing you this note while I'm on call for the 3 hospitals in this county for the love and respect that I have for my town and my patients. You never think it can happen to you. I'm the voice of the ones that are in isolation now or on ventilators in our ICUs, those that before they sadly left us personally told me that I wish I had worn a mask. I have to be the voice of those that have been sick and those that have suffered, those that died and didn't have a chance to say goodbye or hold the loved ones' hands over the past 4 months due to this terrible pandemic. I've been at their bedside and I've seen it all very close. The truth is that after 16 years of medical training, nothing prepared us for this. We all have a role in life, and through this pandemic, I have learned that no matter who we are, what we do, or where we come from, or how old we are, our role is to protect each other. After all the medication prescribed, all the ventilator changes, all the oxygen orders, sleepless nights, the articles read, I know that our lives and health is in each other's hands. We should wear a mask feeling confident and proud that we are saving each other. This is very real. It can affect you, your life partner, your child, or your parents in those beds. Only united and with a little sacrifice can we control this pandemic faster, be safer, and be an example for the state of Florida. Help us to enforce the proper use of masks, social distancing, and sanitation. I suggest that you take my advice in consideration to help you control this problem that is affecting our county in a timely manner. I'm at your disposal for any questions or further recommendations. Please help me to help you. Sincerely, Lowleys, Bobe. I have a letter from Dr. Moss, who's been a pulmonologist here since 1992, and he heads up the group. Again, the only 5 intensivists in town. Dear Commissioners, please help. With the reopening of Charlotte County, we have seen a tremendous rise in the number of individuals testing positive for SARS-CoV-2 virus, with an increase in the morbidity, patients getting sick with COVID-19, and mortality. Charlotte County has one of the oldest populations in Florida, and our population is therefore at very high risk of getting the coronavirus and dying from it. We are the pulmonary and critical care specialists that care for the sicker COVID-19 patients in Charlotte County. Our group comprises 5 board-certified physicians and 2 nurse practitioners, and we've been providing care in Charlotte County since 1992. We know what goes on in our ICUs, and we are alarmed by the increase in the number of COVID-19 patients and how sick they are, and even more how much younger these patients are now. Our hospitals will quickly become flooded with new cases of COVID-19. Our ICU capacity is limited not only by the number of beds, but it is limited by the number of ICU nurses to keep every bed open. The virus that causes COVID-19 is spread by respiratory droplets released when people talk, cough, or sneeze. The virus spreads to hands from contaminated surfaces and to the nose, mouth, and eyes, causing infection. Therefore, personal preventive practices such as hand washing, staying home when sick, maintaining 6 feet of distance, and wearing a cloth face covering, and environmental prevention practices such as cleaning and disinfecting are important ways to prevent the virus's spread. Yesterday, 15,000 new Floridians tested positive. On the worst day, New York State only had 12,000 new positive cases in a day. The economy, and this is from Stanford Institute for Economic Research, can masks help with reopening the economy? Well, we further speculate, he quotes from an article, that deployment of masks in public areas may eventually help the economy with transformation into the post-COVID world. First, masks could prove to be a cost-effective way of trying to reduce reemergence of the virus in the medium run, as epidemiologic models suggest that virus reemergence may necessitate reintroduction of social distancing measures with some regularity over the course of the next 12 to 18 months. But wearing masks could give some hope of removing the need to put the economy into the switch-on, switch-off mode, which would require many businesses to close, open, and close again on short notice. Second, once official restrictions on many forms of economic activity are lifted, it's very likely that consumers will be hesitant in returning to their pre-pandemic levels of consumption of goods and services outside their homes. Consumers' behavioral sentiments are crucial for charting course of economic activity, while prolonged uncertainty may be harmful for firms. Having a mask and knowing how to use it may serve as an extra crutch to help with inevitable consumer anxiety. He then goes on to speak. Charlotte County cares about its citizens. It's up to you, Charlotte County Commissioners, to take a stand to save people's lives and keep the economy going by making it mandatory for everyone to wear face masks whenever in public, in addition to all other precautions. Not making it clearly mandatory to properly wear masks that fully cover the nose and mouth will create confusion in the population, lead to fights between citizens, lead to increase in infection with COVID-19, and lead to an increase in the death of the citizens and health care providers of Charlotte County. We believe that making it mandatory to properly wear masks will protect the people that follow the guidelines and will help keep the economy open. Other states and counties where COVID-19 has already caused catastrophes have adopted the mandatory use of face masks, fully covering the nose and mouth, but unfortunately, too late. Charlotte County needs to do this before it's too late. We attach the CDC site for specific recommendations, considerations for wearing cloth face coverings. Help slow the spread of COVID-19. Respectfully yours, Carlos Mas, MD, Fabrizio Manghi, MD, Loalise Bobe, MD, Edgardo Soto, MD, and Jaime Cancel, MD. Those are the 5 ICU physicians caring for every single sick patient in Charlotte County. Those are the 5 individuals on the front line pleading for a mandatory mask ordinance because they know what's coming, and they know that they cannot stem the tide of the really sick folks that are going to continue to hit the hospital and overload the system. And it is highly likely that one or more of these individuals is going to wind up getting sick. There's already a pulmonologist who got sick and is no longer attending patients at the hospital. So we went from 6 to 5, and we'll go from 5 to 4, and we'll keep going until we don't have doctors to take care of the patients, we don't have ICU nurses, we don't have respiratory therapists. They're just not going to come from someplace else. This is the same situation when we got hit with Irma and we needed debris removal and everybody was over in Texas. Everybody is someplace else. There is no cavalry that's going to be coming to take care of our patients. The news is correct, and the headline from June 23rd, Florida's Surgeon General quietly advises everyone to wear masks in public. And I'll reemphasize the statement. All individuals in Florida, and this is our Surgeon General who heads up the Department of Health, all individuals in Florida should wear face coverings in any setting where social distancing is not possible. And Dr. Jacobaitis, who spoke earlier, is correct. If you're in a store and it's a 4-foot wide aisle, you can't social distance. You're going to walk past that person, and unless everybody's holding their breath, which doesn't happen, there's going to be exchange of whatever people are breathing. His advisory also recommends that all individuals should refrain from participation in social or recreational gatherings of more than 50 people, practice social distancing by maintaining a distance of at least 6 feet from each other and wearing a face covering. I'm hearing a lot of doctors here saying we need to be wearing a face covering. Now, you know, it may not be strictly enforceable. It may not be something that everybody wants us to be doing, but it's a first step. I applaud the city for taking that first step, for leading the charge, for doing the right thing. And while this may be an imperfect document, it's a starting point. It's something that we can come back to and revisit and polish. But if we don't do something today, we don't get another crack at it for 2 weeks or till September. And I got to tell you, things could look a lot different, and by different I mean a lot worse. A lot worse. And it's not one of those things where we can go back and say, okay, you know what, we want to redo. There's no redo. Once it's wildfire in the community and and that area under the curve is not flattened out and everybody's hitting the hospitals at the same time, that's when we have a critical issue. That area under the curve is still there. It's still there, gentlemen. It's not going away. So whether we're able to meter it out, you know, we did very well, and that's the operational word. We did very well. I have gone in public once a week to shop. I try not to go into stores because it's not a good idea to have lots of folks going around. And I see less and less people wearing masks, and I see a correlation of more and more people now coming to the hospital. I'm going to read an op-ed piece that I had in the paper just a week and a half ago, and some of this information is a little bit dated. Some of the statistics I quote are actually worse. But this virus is spreading again, and now it's at an accelerated rate. Wearing masks slows transmission of the virus, and these are indisputable facts. Community spread has now increased, and as we predicted to happen once we controlled the institutional spread. Wearing masks in public needs to be mandatory, especially if we value our community and our economy. This is not about politics. It's about compassion, it's about patriotism, and it's about science. The medical community in Charlotte County is speaking with one voice. The medical leadership at each of the 3 hospitals in Charlotte County have all unanimously voted to support a county-wide ordinance requiring the wearing of masks in public spaces. If you're outside and away from others, obviously wearing a mask is not necessary. However, when you're in an enclosed space in Florida with air conditioning systems, you need to be sure that you're not spreading the virus and others are not spreading it to you. It was suggested by one of my physician colleagues that it's just as important as wearing a seatbelt in a car, which is now regulated and required by law. There are rules in place created to save lives. We need to consistently follow protocols so that we can improve our current situation and safeguard our future. Best practices established by the CDC need to be maintained. Businesses must be able to require the wearing of masks by everyone, not just their employees. It seems that there's a double standard. The large corporations and chains require the wearing of masks. due to liability issues. However, smaller business entities are different. The standard sign should say, no shoes, no shirt, no masks, no service. And as I said, this past weekend I was out shopping, I witnessed less than 50% of the people wearing masks, including employees. So the majority of the folks were the employees. It's critically important for people to understand that pandemics come every 100 years. And even though we're not used to these types of restrictions, they are essential. Everybody I know is suffering from pandemic fatigue and cabin fever. But this is not something that's going to be done in 3 days or 3 weeks or 3 months. This is going to go on for quite a while until we have a vaccine. I applaud the City Council for discussing the issue last week and taking action to enact a mask ordinance at their meeting on Wednesday. They apparently have a good understanding of the gravity of our situation. They also grasp the fact that for our economy to continue to open and thrive, we need to be vigilant in our approach to living with this virus. And make no mistake, this is a long-term affair. Hopefully a vaccine is on the horizon and there may be something available in the spring. Unfortunately, that means that we're going to be dealing with this for the next cold and flu season. And as Dr. Pappy showed us, our community spread in Charlotte County was averaging about 10 cases a day for the middle of June, and then the following week it was up to 30 cases a day, and now we're averaging 40 cases a day. So the latest data is showing this thing is starting to explode here. The rate continues to increase and now has jumped to over 40 cases. As of Tuesday, all of the hospitals are putting visitors back on the restriction. And if we don't redouble our efforts to limit the spread of the virus as much as possible, we'll be experiencing a surge to our healthcare systems, which will be unsustainable. Between the 3 hospitals, there are now over 40 COVID-positive patients. That's the highest we've ever had. And there are 50 ventilators with an option to convert 50 more for a total of 100 for 185,000 people. Our hospitals are becoming saturated with patients under investigation. That's the PUIs for COVID. And the problem is it's taking longer to get the tests back. So we have a backlog of individuals that are choking at our system, and we can't move things forward. The fear is that this will not only persist at this level, but will increase significantly to the point where it is unmanageable, and we will not be able to treat the influx of patients that are going to be coming to the hospital. Now, I know we value our freedoms in this country. I certainly do, and there are conventions that keep us safe. The wearing of masks in public is about public safety, okay? It's about you protecting your fellow man. And I've heard a lot of discussions about wearing a regular mask, wearing face coverings, wearing a surgical mask, wearing an N95. Yes, if you're wearing an N95, you're protecting yourself from everything. But if everybody wears a face covering of any sort, then we are protecting each other. So you're wearing 2 masks because the person across from you is wearing a mask and you're wearing a mask. Younger individuals may not understand that they're not immune from catching this virus, and it's not guaranteed that they'll have no medical issues. We've seen people as young as 11 years of age that have succumbed to the virus in Florida, and there are stories nationwide and globally of children even younger dying from this virus. A young person who contracts it may be asymptomatic and not worry about themselves, but they're likely to bring the virus back home to their families. And at that point, they can infect the whole household, their siblings, their parents, their grandparents. The virus has the greatest impact on people with compromised immune systems, and individuals in that category include those with advanced age, people dealing with cancer, or others that have immune suppressed due to a disease or failing immune systems. It also includes people who've damaged their lungs, those who smoke or vape or do other things. The most important thing we can do to safeguard your health right now is make sure that you eat right, you exercise, you get plenty of sleep, because that's important for bolstering your immune system, and that you are understanding Charlotte County physicians are unanimous in their recommendation, and it's important for everybody to wear a mask when they're indoors, when they're around other people, and they can't socially distance. And I'll yield back, Mr. Chairman.
Thank you. Commissioner Deutsch.
Thank you, Mr. Chair. I'm probably not going to say anything you haven't heard before, but I was the slowest guy pushing the button, so I'm recognized last. And I just want to share the thoughts. For the last several months, I probably have spent 3 to 4 hours a day talking about the virus, virtually wherever I am, wherever I've been. I estimated that I know this, I've gotten about 250 emails. Unlike here, there were more in favor of masks than opposed when we all got the count. My count was skewed quite a bit from what I saw. And I've had about 40 phone calls. Chris read Dr. Moss's letter. I know the doctor. He called me. We were on the phone 25 minutes last night. He was unbelievably passionate, and I know he's talked to you, Chris. I've never seen, in all my years in elected office, I've never seen this level of passion. I've actually been threatened by both sides now, the ones for and the one against. That's unique. Usually it's just one side that threatens you. Maybe it's because, admittedly, I'm probably the most vulnerable, the most susceptible, and if you would look at all the charts, I'd be the first one out of the 5 of us that should catch this thing. I've worn my mask from the beginning. I certainly wear it if I didn't wear it at my desk all the time, when I go in our little small kitchen upstairs, which is only like 3 by 4 feet at tops. I yell at my colleagues when they don't wear one on the elevator. And I've tried to be very, very proactive about the question of wearing a mask, because I believe even though some of the masks we have, and this one's homemade and it's doubled, no matter what it is, it's going to help some. It's going to help some. Now, I will say this, and I'm trying to think, outside of one nurse who spoke today, who is in the medical profession somehow, every single person that's contacted me in the medical profession, every single person involved in medicine recommended wearing the mask, washing your hands. This thing's been an education for me. I'm 80 years old. I found out my usual hand washing was only about 6 seconds. So now I'm pushing to get close to the 20. And I'm trying to wait for the hot water, not just rinse them off with the cold water and figuring I'm done. And the social distancing is great. And if we could all do it, we wouldn't have to wear masks. But there's times where you can't social distance. Whether you're going to pass somebody in the hall, or they're going to step into the elevator with you if you're going somewhere, or you're going to go down by the aisle with them in the supermarket. You can't alleviate it all the time. You can't keep 6 feet away from the people all the time. I wanted to keep the beaches open, because most of our beaches, people are 15, 20 feet apart all the time, and I never saw a problem with that. But I think we've got to use our heads. And, and basically in my mind, when I'm wearing this mask, the scientists, I'm not a scientist, I'm not a medical person, but they tell me I'm doing this more to protect you than myself. It helps me a little bit, maybe keep something out, but I'm protecting you. To the best of my knowledge, I don't believe I have this thing. I would not want it. And I'm probably going to talk about it later, but I think the mask shows that I care. I don't have to like you, but I care about you. And I care enough that I really wouldn't want to give this thing to anyone. I like the idea of having everybody wear a mask. The reality is, and I think all of us are trying to use our heads, and we're not going to the supermarket or the store or the dollar store or whatever we did every single day. We're trying to limit it. I've been trying to go every 2 weeks or every 10 days. So in reality, what are we really talking about for wearing a mask? maybe an hour or 2 hours every day to show that we really care about somebody else. So I'm trying to look at this thing and put it in all perspective. And I have to say, probably about 85% of what we listen to today, on both sides, I believe and I accept, and it's true. We're a passionate people. We're all passionate. I know I am. You know, I don't know if my passion's about the Lord, about my country, about our flag, about our military, but I'm passionate. I don't know if I'm passionate about Hector or Joe or even Kenny down the other end on occasion. You know, I've been around a long time, and I must admit, I've been blessed by meeting so many incredible, wonderful people throughout my life, and they didn't necessarily happen to be one of the presidents I've had the opportunity, the honor to meet. One was a custodian at a school where I worked. And I have to say that, you know, there have been a lot of people that I've respected. There's a lot of people I like. There's a lot of people that I've loved. And I'm thinking back. There are some people I really don't care for. There's even some people I don't have any respect for. But there's no one I really, if I think back, I've ever hated. And if I had this thing, there's no one I could think of that I'd want to give it to. I wouldn't want to do that, no matter who they were. That's why I'm wearing my mask. My problem is, this thing isn't enforceable. I wish I could turn around and say, you know what, everybody out there, raise your hand and promise me for 6 weeks you'll wear a mask because we might get rid of this thing. By the way, one of the, quote, experts, unquote, on Fox News this morning, sorry guys, but you know, made a comment that Dr. So-and-so from the so-and-so said if we all wore masks, in 6 weeks this thing would be over. So I'd like to say, everybody raise your hand, promise me you're going to wear a mask, and make sure that everybody else you know, so we don't hurt anyone else who's going to work. I'd walk out of here happy. I don't believe this is going to pass. It's certainly not perfect at all, but I think I would like to see, and Joe, I'll tell you, I get a kick out of this, you know, because we never talk to each other except when we're here. I wrote down about 3 hours ago a resolution strongly recommending compliance. That was like several pages ago. But you pushed your button quicker than me, so, you know. I don't know here we go from where, but I'm going to tell you the responsibility, and we've lost about half the people in the room now, but there's probably about 40 of you out there now. The responsibility to get rid of this virus rests with every single person in this room and every single person out there watching it on TV, because we can all make a difference. Wash our hands, keep our distance, and it's hard to do that sometimes, and wear a mask. I don't believe this resolution will work because it's not enforceable. It's really not enforceable, and that frustrates me. However, if a motion's made and seconded, I'll probably vote for it because I think we have to send a message to the community. I mean, the backup is the resolution. Now, as far as the business is concerned, I got only 2 businesses that were opposed to this. And the general consensus from several times over that on the businesses, and some of them are doing it independently, they want us to do this. So when somebody complains and they go in the store, they'll say, well, the county's requiring this, so, you know. But the important thing, it isn't that, it's that we do it. I had a meeting yesterday with the Chamber of Commerce, and pretty much in our discussion, they voiced that. They said, you know, most of the businesses are doing it. Some of them nationally are going to make a statement to do it. But they'd like the backup from the commission saying, hey, when they get a customer that's not happy with it, saying, well, the county wants us to do it. The county said that we have to do it, so we're doing it. So, that, you know, that was the comment on the business thing. But But I think it's incumbent on every one of us to do this. It frustrates me it's not enforceable. We're not going to have a masked jail. We're not going to have a masked police. But it's up to every single one of us and take the passion that we have for the fact that we are so blessed to be here in these great United States of America, that we can get out here and voice our opinion. Let's show that we care for the guy or the gal next to us, and let's all wear the mask and do it. Just do it for 5 or 6 weeks. If you have a reason where you can't, no one will question that and accept it, but let's do it. We could get rid of this thing. I'm starting to babble on like everybody else, but it's frustrating because there's no simple answer. No one planned on this virus, and from Washington down to Charlotte County, no one really knows how to deal with it or what to do. We're doing the best we can. We're listening to you folks. We're listening to the professionals. We're listening to the scientists. We're trying to do what's right. But if every one of our folks in Charlotte County stood up and said, hey, I'm going to keep my distance, I'm going to wash my hands, I'm going to wear my mask, that would be the best thing that could happen. But I only have a responsibility of dealing with one person on that. It's up to everybody out there to make the difference. Thank you.
Thank you. Commissioner Constance?
Thank you, Mr. Chairman. I move an emergency ordinance of the Board of County Commissioners of Charlotte County, Florida, in response to the public health emergency within Charlotte County resulting from spread of the coronavirus disease 2019 COVID-19, providing findings, providing definitions, requiring face coverings as more fully specified herein, allowing for exceptions to the face covering requirement, providing for enforcement, providing penalties for violation, providing for sunset, providing for conflicts and severability, and providing for an effective date.
I have a motion.
I'll second that, and I want to make a comment on it because,
Commissioner Deutsch, you're recognized.
I'm sorry, thank you, I thought you gave me a wink of an eye. I don't believe it's going to pass. I'm going to vote for it. I think we have to send a message. But if this doesn't pass, I would really like to see us come out with that resolution. And Commissioner Teseo suggested that, and I had written it down, and Ken hinted that way. That might be what we're going to end up doing, but I think we've got to do something, Mr. Chair.
Thank you. Just to let you all know, Venice voted down a mask ordinance and it was voted down, and then they supported unanimously a resolution. Indian River just voted down a mask ordinance as well. Commissioner Doherty?
Thank you, Mr. Chairman. I just wanted to make a couple of final comments, just for the public's sake. You know, my wife and I, when we go out to Publix or Walmart, we wear a mask, not to protect ourselves, but and we realize it has minimal impact, but we're concerned about people being afraid that we may give them something. So we simply wear it for that reason. But we do that we make that choice to do that. And I think it's important. I think what bothers me about this ordinance is that not only that it's not enforceable, I think there's a better way. And that's really what the point I was trying to make, is I think there's a better pathway. It has to happen, I believe, through a partnership with the community, community support, as Dr. Pappy said earlier. Not only the public, the individuals, but the businesses need to be able to help us at the point of entry of their businesses, to be able to post for the general public what their rules are, what their policy is as a business. They need to make that choice. I want to give them that choice as well. But basically, so people, when they walk up at the curb line, they can look at that front door, see no shoes, no shirt, no mask, no service. Otherwise, they get trespassed. And that's a bigger deal than a $25 fine. So, I mean, the bottom line is, I think it'll be a better situation if we approach it that way, with a partnership mentality as opposed to the big stick that says we're going to fine you and police you. I think that there's a better way of doing it. I like the concept of a resolution. I'd love to have more of a dialogue with the business community to see how that would be framed. But again, it gives them if that gives them the support that they're looking for from local government, just so they can But see, I'm talking about, they put that on the sign, per resolution 20-something or other, because you don't want them to go through the front door in the first place, period, if they're going to allow people to go in without a mask. So it makes it simple. There's no exceptions. Either you got a mask on or you don't patronize that place. If I don't see a sign on the door because they choose not to require a mask, my wife and I will get in the car and go somewhere else. Simple as that. But the bottom line is they make a choice, the individual makes a choice, the business makes a choice. But a resolution that says we can do it or will help support those that want to do it, I think makes a lot of sense. Thank you, Mr. Chairman.
Thank you,
Appreciate it.
Commissioner DeSalle.
Thank you, Mr. Chair. Yeah, that was to my point about the resolution.
Yep.
So far, we've been making recommendations. You do the resolution, it's got the full faith and backing of the commissioners. You post it in the window, and it could just say, we're just requesting all businesses to adopt and implement and administer all these, if you can't social distance, wear a mask, or the way it's worded now, you wear a mask and make the exception social distancing, so the mask is first.
If they want to.
If they want to. And most businesses, they have that tool in the tool belt now to post. Because even New York, obviously at the beginning they were, had that mask mandate right out of the box, and it was a complete flop. The NYPD, it was taken away from them, the enforcement. It couldn't be enforced. It was a train wreck, and the mayor ended up putting it on the businesses. To your point about the point of entry, that's where it needs to be. You go to Disney World, you go to, all those millions of people that visit, you go to that same single point of entry where you get scanned in, they check you out, and boom, you're in. That's how it's got to work. It's really a partnership with the businesses, with the backing of the county through a resolution, because you may want to support this mandate, but to me, I'd be fooling myself to say that this is a mandate. It's not. It's something to say we did something and we're mandating it. 11 exceptions, and one of them social distancing, which is a higher standard than a mask. Again, the golden rule became the exception. How does that happen? And the fact that this was put on a Friday agenda, I liked when it was on the original agenda, we were going to have discussion and direction so we could have this. And then on a Friday, this got put on for a vote today as an emergency ordinance. Literally, I saw my eyeballs on it Friday. I worked on it over the weekend, had some one-on-one on Monday, and here we are. That's how we institute a mandate on every citizen in this county? With a document dump on a Friday, and we have to review it over the weekend and vote today in the morning? This didn't even have time to saturate in the public domain for people to look at it and read it. I mean, it would be unconscionable for me today to vote on a mandate so poorly written and not advertised, where we waived the right of notice to the people. I mean, I support the fact that wear a mask when you can't social distance. There's no problem with that. I support those safety protocols. It's how do we get there? How do we deliver it to the public? And how do we get the buy-in? The mandate doesn't do it. It's just so you can say you have a mandate. That's just the bottom line. I mean, I'd love to support something that made sense. I think the resolution is the next step. I really do. I think if we can craft it, a strong resolution where they can adopt it, it gives those businesses the backup that they're looking for. Put it right in the window. By resolution of the Board of County Commissioners, this is it. And then they could change their rules or however they want to do it. So anyway, and also in California, I think there were at least 5 or 6 sheriffs that said they're not enforcing the mandate they had there because it's unenforceable. And again, that's another problem with the mandate. It's just very hard to function, I guess would be a way to say it. Thank you, Mr. Chair.
Thank you.
Well, no,
You were in, you're out. I'm checking because I'm going to say a few things.
Go ahead, you go first.
I've been directing traffic. Now I'm going to say a few things. So I'm not going to reiterate what's been said, but a couple things. We talked about liability, and big boxes or big retail or big grocery store chains are implementing mandates for their staff and such. In OSHA, which has bigger fines than what this is, if you put yourself in an oxygen-deprived environment, the employer is subject to a standard far beyond this. And there have been tests done with oxygen readers that indicate you fall below a safe level of oxygen within a short period of time. It was less than 30 seconds. It went from 21% oxygen to under 17.5. And that's when the alarm went off. I can't make my employees in construction wear a mask that does that. I would be sued for that. Now, they wear particulate masks, but if they take off their particulate mask, you see how much drywall dust or sawdust and all this kind of stuff. If they're cutting concrete, same thing. They're required to wear a mask for their protection. It does not keep out 100%, and these are big particles, folks. Big particles. You know, I like the social distancing thing. It reminds me to stay away from people. I have seen so many people in grocery stores with masks and gloves. They touch everything in the store. They never sanitize the gloves. They go into their purse or their wallets or what have you. They're touching everything. I know that if I'm carrying my hand sanitizer and I don't have gloves on and I don't have a mask on, I use this to clean off my hands, and I also wipe off my face, and I do it periodically. But beyond that, and what's even more important to me, is I take 10,000 IUs of vitamin D every day. I take immune-boosting supplements to help my immune system. Hell, I was in New York and Connecticut in March when the outbreak was huge up there. I was with 50 people at a leadership conference. Nobody got sick. I guess my point is that personal responsibility means a lot to me, and I'm responsible for myself. And when I go out in public, if I choose to wear a mask because I'm going to be close with people, I should put one on. I should. If I'm going to be in close proximity, I should have a mask on. But my goal when I go out is to socially separate, because that reminds me every day of what other people are doing and not practicing that they should be. They constantly touch and pull and tug at their mask, pulling them down, putting them up. Look, I have probably 3 masks in one vehicle and 2 masks in another vehicle. Ask me how many times I've washed them. I haven't. I put them on, go in a building, walk out. I wear them at the doctor's office where they're required. But I also have a doctor that doesn't require masks. All the doctors in Charlotte County are not on board with the mandatory mask ordinance. Many of them are, and you've heard those letters, and they mean something. But with this, as it's written, I would never require somebody that's 2 years and 1 day old to put on a mask. I would not do that to that child. They don't understand. When people of 17 years of age, I've been told, don't have the ability to actually understand the difference between right and wrong. I don't agree with that, by the way, but I've been told that. How can you get somebody of a very young age to understand why they need to wear a mask when they're crying and they're tugging and they're, you know, Monroe County was, I think, if you're over 6 years of age, makes more sense. 7 years of age. If you can get your child to wear one and they're wearing it properly, great. That's a wonderful thing. But I haven't seen a child, I haven't seen an adult sit, go through a store, anything else, and not abuse their mask and not take care of what they still should be taking care of. So masks, I do recommend them. But I'm not in favor of mandating them. Anybody else? Okay. Hearing no further discussion, I'll call the question on approval of the ordinance. All in favor, please signify by saying aye.
Aye.
Opposed? Aye.
No, whatever.
No, aye. It is turned down 3-2, and it did require a 4/5 vote.